I am very focused on treating the earlier stages of peri-implant disease and that peri-implant breakdown, which is peri-implant mucositis, which is where the patient presents with inflammation of the soft tissues around the implant, yet there has been no progression to alveolar bone and loss of crestal bone. So my treatment philosophy for those patients is the earlier the intervention, the better the outcome. Non-surgical treatment has been shown to be very effective in patients with peri-implant mucositis. And for me, that involves removal of biofilm and calculus from the surface of the implant, be it the collar, the threads, and or the prosthesis. I would use a combination of hand instruments that are made from a very soft titanium. It must be much softer than the titanium of the implant to avoid and reduce the risk of damaging or scratching the implant. And using hand instruments around implants is slightly different than using them around natural teeth, whereas you have to navigate your way in between threads and also work on smooth and rough surfaces. So you use a combination of vertical and horizontal strokes. At the moment, we're, reduced in our aerosol generation procedures. So for me, hand instrumentation is my go-to and always has been to start the treatment using those hand instruments.